Oh, that was sweet of you.
Thank you. So, since you were still asleep, I was texting
Okay.
with Ivy,
And
and she got promoted last night.
really,
Yep. Maybe it's because you were asleep, and she wasn't, and you still have to be like, they're still trying to find you. But I think you have a good chance.
that kind of frustrates me. With the
You're gonna be.
exception of like last week, I know I've been working harder than Ivy.
It's gonna be fine, babe. You're gonna get that one for sure. I think they're just not being able to find you. You know.
Yeah.
Also, let me grab my phone. So I wanted to talk to you about being more around Polito. Since you like it there. Um, I tried to be there in the beginning, and Ivy made a really good point, stating, "Yeah, things change a lot." So I wanted to ask you, what if we try to stay more in Polito, and me just trying to um get comfortable,
That would be fine.
which is probably, yeah. I mean, I'm trying to become an officer, which, what, according to Ivy, they don't really care for the long haul as long as you're respectful, and I'm trying to be.
Yeah, it's basic rules. Like if you see them commit crime, don't report it. Stuff like that.
Oh no, that's obvious.
Not that they do crime like out in the open. I don't think I've ever seen them actually do crime.
I haven't seen them do either. But yeah, let's just try and maybe when we have more time, just hang around there. Since you like it there, and I know Ivy is there, and you're actually two people who draw me there. So I mean, you more specific than Ivy, but
And as you say this, I'm asking if I can get a shift at the hospital.
yeah. I mean, God, what kind of sirens are that?
I don't know. I don't think I've ever heard these sirens.
Also, I thought I asked my the dispatch command what the potential is for mobile dispatching. So I hope I get more information about that soon.
Okay.
Yeah, sorry, I just threw that over the chair last night.
It's all good. Okay, forgive me. I don't know how to spell this word. I don't even know how to pronounce it.
I think you were pretty close.
I blame my upbringing for that one.
You blame what?
My upbringing. I grew up with so many different accents. Like some of them mesh.
Ah, okay.
Oh, could you do that one more time?
So, wanna go grab some food at Gay Base if there's actually someone around?
There is no one in Polito right now.
Really?
Yeah, I looked at the directory. There's no one at Go-Go's, no one at Gay Base.
Well, I guess it's gonna then become Burger Shot today.
Yeah, that's where I usually tend to go. I should probably move the van the camper like 2 feet back or something like that.
Yeah, maybe.
Mainly because of this bush right here that you keep walking through. We have these bushes where I grew up. The ends of it are as sharp as a hypodermic needle. They
Yeah,
hurt.
maybe we can find like um also like a bit of spot with a bit more outlook. You
I
know,
mean,
like
outside that, I really
those
like this
things.
spot. It's just
I
having
mean,
that bush right there at the door.
yeah. So Burger Shot or
Yeah.
moving the camper.
Now let's go to Burger Shot.
Hey, Bambi.
Hello.
Hey.
Hello, hello. Welcome to the Trust Circle. I am tired today.
Same.
Mood.
Alrighty.
Alrighty, patient incoming.
Yep, we got some bruising. You want to handle or observe?
I'll absorb this time. I'm still waking up.
Yeah, no worries.
So who's it gonna be? Olivia.
Yeah, Casey had a wild story that he hit a billboard and a light post and everything.
Oh,
It's
shit.
Casey.
Yep.
Hello,
Huh.
arcade.
Hello,
That's
party
nice.
people.
Hi,
Ow.
Casey. How you doing?
I'm doing good.
I fall from billboard, then onto pole, then onto lamppost, and then onto tarmac concrete road.
Darling.
Oh,
All right. Let's get you to where I can make sure you're comfortable.
like,
Bambi, Casey, Casey, Bambi. Bambi's a resident. She's going to be
Hello.
observing.
ah,
Casey's a frequent flyer. He's in here regularly. But we love him.
Is it usually because of flying lessons?
no, it was the second
It's
time
very
I've ever
random.
crashed off a bike, to be honest.
I was gonna say, it's usually more like duty type stuff. All right, Casey, if you don't mind, I'm going to go ahead. We're going to take off your jacket and shirt because I just want to look at the torso, see coloration of bruising. Make sure I don't see any initial signs of internal bleed.
Alright.
Okay. Basically, for the bruising, I'm seeing if it's, our typical blues and purples. If we start seeing a pooling of red, that could be a concern for me. I'm also going to start filling around for any tenderness. Okay. I am seeing the blues and purples. I'm not seeing any signs of tenderness as cause for alarm. What I'm going to do here is I'm going to wash out these cuts and scrapes. I'm also going to treat the road rash. I'm going to put a thin line ice pack here across the torso, secure it with an ace bandage to where it'll be good to go on duty. You're going to have some discomfort with twisting and turning, so just be careful with sudden turns, okay, darling?
Alright.
All right, so with road rash, much like a burn, we're going to wash it with lukewarm water and not saline because saline is salt water. We don't want to burn the shit out of it. So we're just going to gently wash that out, getting any debris, dirt, and that's just going to keep to where those don't get infected. Pat it as dry as we possibly can, of course, gently again. We're going to use a topical antibiotic ointment again to just stave off any infection that could occur.
Alright. I know that I'm being crazy. No.
All right, we're going to wrap with gauze. We don't want to use any sticky bandages. So whenever you do change your dressings, Casey, make sure non-adhesive, okay?
Okay, no glue.
Yep, because otherwise, when you take it off, you're not gonna be happy.
So she is securing the
All right,
gauze.
next I'm gonna put that thin lined ice pack, secure it with an ace bandage.
Oh gosh,
Yeah. All right, darling. There you go. Like I said, some discomfort twisting and turning, but
Right.
definitely a lot better than whenever you first came in here.
I'll take.
Please be careful.
Yeah, I'll try to and stuff. Oh gosh.
I love the commitment.
In what situation would you use substance O?
You feel
I
free to
mean,
rest
hey,
here,
no,
but you're good.
no promises.
I know. I appreciate the honesty. You let us know if you need anything else, okay, Casey?
Or an injection if
I'll tell you
there's no
too.
doctors around to
Okay.
temporarily help them off of their ailments. You know, when some people can't run or drive a car or pull out their gun if it's a cop. They have like really bad injuries, then we can use substance O to bridge the gap between when there's a doctor
Okay.
around
Any questions there, Bambi?
No.
or
Well, so you just based internal bleeding based off of color of bruising?
I look at color bruising, I look at tenderness. If I don't see any initial signs, like as far as like any, triggers, I'm gonna go ahead and treat for on site. There's no need of pushing them
I
through
feel
an
like,
MRI machine when not necessary.
I'm not really getting any
Now,
Yes.
if I notice any
pulse with
tenderness, any
anything
like
other
of my
than just
colorations,
bruising
I'm gonna
or
take them in and get
stuff,
confirmation.
so
Because even if
I
I feel
kind of
it
have
or
to
we see
work on
that,
them
doesn't
myself.
necessarily mean bleed, but good
You gotta stick around
signifiers of
more
a
because I
bleed.
get all the phone
Yeah, it seems like every
calls,
doctor has different
gunshot
methods of
wounds,
seeing,
stab wounds.
checking for internal bleeding.
Yeah, I
so.
get none of that,
Yep,
and I'm
you go
here
with what you're
every
most
single
comfortable
day
with.
for like 4 or 5 hours a day, basically, except for weekends.
Yeah,
Like I get
some
nothing.
shift one can either get like a lot of things or nothing, but like shift two gets like all the good shit.
How are you, Arcade?
Yeah,
How are you doing?
I think shift 2 is too late for me though.
Are you okay, Crash? All right. Crash is putting himself into fish jail.
Breaks are always good.
Oh, look at that! I nailed it.
I've been thinking about taking a break
Let's
for a
make
little
sure.
bit
Did I
now.
miss anything? No, wait, I nailed that.
Wow.
I
where's the lag?
except for making sure the patient was laying comfortably. It basically says immobilize fractured bone limb, but it also says apply a splint. So yeah, I would say that's yeah. Provide pain relief. I just said that. Secure IV access and administer IV fluids. Monitor vitals. Yeah. Okay, I didn't mention monitor vitals, but I feel like oh,
I guess
that's
it's
you.
me somehow since I'm in the call rotation, even though I went to 13 Bravo.
Good luck. How about you ladies? Can you help me out with this?
Oh, what's going on?
So, I'm not getting any. Like every time I get calls, it's just bruising. They've been in a fist fight. Someone fell off a bike. They got a little cut up. It's like small stuff,
Okay.
and it's been like that almost ever since I became a solo. Like I don't. I think the worst thing I had to deal with was like a major cut, and all I did was like put pressure on it and get them to the hospital and the doctors sew them up. Like obviously I did more than that, but like it wasn't a lot to it. So the thing for me is to get EMT. I mean I guess I gotta do my own practice. So I'm just kind of pretending up something that happened, and then I'm just trying to like without looking into the SOPs, like oh this is what I would do on scene, and then
Well,
trying to
because I'm
see
a
if I
resident, that's something the doctors do to me all the time. Is they just randomly make up a scenario and like, hey, what would you do?
yeah, that's what I'm trying to do, that to myself sort of, and just kind of yeah, just pick scenarios that I could see happening, like for example like a GSW to a specific area, and then you got to consider if it's through oh see
Oh,
ya.
and there she goes. But yeah, even in my previous career, that's something we would do. Is we would be like, oh, this happened. What would you do? This happened. What would you do? But normally we would have someone
Yeah,
to bounce it off of.
yeah.
Now, if you guys' SOPs are more fuller than ours, then yeah, you can just bounce it off the SOPs afterwards.
Yeah, because I mean, I feel like I've read through the SOPs. Obviously, I put more effort into some stuff and less into some. Like, it's not like I'm putting a lot of effort into like radiation injuries.
Well, the
I
key
feel
thing
like
with
that's
radiation is iodine.
yeah, but I mean, in our SOPs, like if I'm reading them right now, they're talking about wearing
Oh yeah,
proper
proper.
protective
You need like
equipment.
lead suits and stuff like that.
Yeah. Iodine, ask the patient to strip clothing. Like, obviously, I would have to remember to look it up because it could happen that I forget them to, like, strip their clothing and stuff like that.
Well,
Wash
so
patient with soap and running water for 2 minutes.
you know, and the key thing is you need to strip them of the clothing before you get them to the clean area.
Yeah.
But but after you remove them from the contaminated area, it's like in the middle zone.
Yeah. You washed them and everything. Yeah. Ask for symptoms if required, transfer to hospital. Yeah. And then send contaminated clothing items to the decontamination, and then consume an iodine pill myself after decontamination.
You know that's something we never did in the military.
Radiation stuff?
No, we were quite heavily trained in radiation stuff, but we never took the iodine pills as the treaters.
Oh, okay.
Mainly because like the radiation that you would give off from being irradiated is very low.
Yeah. Because I feel like 99% of the stuff is the same thing. You basically wash it with saline, put on antiseptic, bandage it. If it's an open wound, if it's a smaller open wound, like bandage it, put pressure, and see after like 30 seconds if it stops bleeding by itself. And if it's a larger wound, you basically still put bandage around it and bring them to the hospital.
Yep. And just remember,
And
if they
then
bleed through that bandaging, you bandage on top of the old bandaging.
yeah. And then it's just like, because yeah. And like I said, like 99% of my calls are all the same thing. It's literally wash with saline, put antiseptic, bandage. Wash with saline, put antiseptic, bandage. Every now and then you get a broken bone, put a splint, pain relief, IV with saline, potentially ONEG, another IV with ONEG if it's a lot of bleeding. Hospital. Like it's. I'm not saying it's boring. It's just like once you get the basic like 5 steps down, it feels like you can take care of most things unless it's like some crazy ass shit that happened.
And honestly, that's the reason why I applied to become a doctor, not an EMS.
Yeah. Thank you for your service.
Yeah, because honestly, like my training that I've had in my life, it's more suited for EMS, but I wanted the challenge of being a doctor.
Yeah.
Radio check?
10-2.
Done too.
I think Crash just did. No, that's not Crash.
So here's a question then. Let's say you got a GSW and it's a through and through.
Okay.
So in our SOPs,
What
it
area of
would
the body?
say, let's say shoulder.
Shoulder, okay.
Yeah. So in our SOPs, it would say like apply pressure to the entry wound, check for an exit wound,
Yeah.
and then just like start washing and stuff. But my question is, do you, let's say you do the entry wound, you do find an exit wound. Do you put pressure on both
Yes.
wounds then? Okay, it doesn't say in the SOPs. It
it's
just
very
says put pressure on
common-
the entry wound.
It's very common for the exit wound to actually bleed more than the entry wound, because usually the entry wound is cleaner than the exit wound. So it's more times more important to put pressure on the exit wound than it is the entry wound.
Yeah. Yeah, but in our SOPs, it just says apply pressure on the entry wound. It doesn't, and then it says search for an exit wound, but it doesn't say apply pressure on the exit wound.
Jason?
Yeah, hi.
Hey, what's up?
I'm okay. Just I've got a few boo-boos. If someone can help me.
How'd you get boo-boos?
Locals are being crazy at me right now.
That feel better?
Yeah, it's nice. Thank you.
Okay.
Thank you very much. All right. See you later, Bambi.
That's funny.
What the hell? All this.
Suppose no one tripped over me.
Like, for some reason, when I
Mark,
put on
I
the
have a question for
camera,
you.
it shows blank
Mickey, I might have an answer for you.
I
Yeah,
hope you
that's,
do.
from
It's
some-
about medical SOPs, so.
Okay.
Yeah.
I get the gist of an O2 mask, but can you just kind of tell me exactly how the fuck do I even explain
No,
this?
I can't do a picture.
Like,
Oh.
in my head, let's pretend you have an open wound. I understand bandaging or like putting pressure to stop the bleeding. I get that. With the O2 mask, I get that you want to give someone oxygen. I want to kind of understand the whys or when, not whens, but the whys actually.
The why is
I'd
for
have
one
to
to
say.
give. Well, actually, yeah, it's your final. If you can explain it, explain.
So the oxygen is mainly for more serious calls. Say they've got a massive gash in them and they've gone into shock. The shock is the main part that you're highlighting here. Because when
Hey, I
someone
kicked
goes
an
into
old man
shock,
out of his wheelchair out there. He might need some medical attention.
oh,
Also,
Derek
I found a
Phillips.
wheelchair on the freeway. Yeah, Derek Phillips. Yeah. I'm gonna give this to you guys.
Yeah, it'd be best to give to a doctor because they sell them.
I don't know whose it is, but they were. It was in the middle of the freeway.
Yeah.
We should honestly, when we sell one, we
I
should
think
honestly
they're
put like a
just gonna
tag on it.
multiply.
No, you need to sit
Yeah.
in
It seems
it.
to be a common occurrence.
If you sit in
lately.
it first and then pick it up, that makes it that it doesn't weird shit.
He is out there. If you wanna help him. If not, you know what? I'm not gonna.
Hello.
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 Hi.
Hello.
What we got going on?
Yep.
Maybe you can become.
She showed me a cool trinket she got, and I smacked her with the handle of it.
Sup, bitches, me again.
Hi, Derek. All right, Bambi, you want to observe or you want to treat?
I'll treat.
See you soon, Mia.
See you. Alrighty.
So what happened to you again? You got hit in the head?
I got hit in the head or the hatchet handle, not the blade, not the sharp bit.
Okay. Just like the back end of the hatchet?
Yeah, he didn't mean to. It was an accident. I was trying to show him my cool thing from the treasure hunt.
How's it looking, Doc?
Derek,
It's
go
not
away.
looking bad. I mean, we
She
have a
ever
head
gonna
injury
walk-
and the patient is conscious and talking.
She
These
ever,
are all good
she ever,
signs.
she ever gonna walk again? We need her for this ice hockey championship, man. She can't be out of the ice hockey.
All right, just go and look at this injury spot.
Where am I?
Based on what I'm looking for is okay. Just a nice little bump. And is there any bleeding?
No, I don't feel like there's any bleeding. I've had worse. I just wasn't expecting it, I guess.
All right, so I'm gonna ask you a couple questions. Do you know what city you're in?
Yeah, Los Santos.
All right, can you name me 3 things that start with the letter C?
Candy, cats, candelabras.
Perfect. Now I'm just gonna shine a light in your eyes, okay? All right, just checking for a dilation on the eyes. All right, perfect. Yeah, so Marcy, this just looks like a basic bump on the head. Really nothing major. I put some ice packs on it and just.
Yep.
There's no signs of concussion or anything like that, so.
Mm-hmm. So, darling, of course, if whenever you get up, if you got any blurred vision, any dizziness, you start seeing nausea that's out of the ordinary for you, make sure you come back into us, okay?
Okay.
No, don't go anywhere quite yet. I just have some questions for you really quick.
Okay.
So I'm looking over your medical report, and it looks like you had a blunt force trauma to the torso. Is that still bothering you?
No. I was seen by EMS for that before.
Perfect. Okay. And I see one more thing. A bruising and bleeding to your right leg. Is that still causing you issues? Is that still causing you issues?
The
Bruising to
what?
the leg.
Sorry. Oh no, that was long ago. That should be fine. I'm sure
All right.
that somebody looked at that the other night. There was a doctor with blue hair.
Okay.
Sometimes bandages come loose, so we just like to make sure they get all
Yeah.
tightened.
Is there anything else I can do for you at this time?
No, I should be good. Thank you so much.
No problem. You take care.
Yeah, you too. Have a great rest of your day. I hope that guy doesn't bug you too much.
Yeah. Oh God, Derek.
That's not right. That's not right. There we go. That's more like it. That's more like it. There we go. That's more like it.
Derek, did you put your wheelchair in the caged area?
Yes, I did. I hope I don't want to be a pie. Yoink. If you got a $20 bill, put your hands up. There's $50 bill, put your hands up.
Jesus.
I don't like him. He called me a pussy. That's not very nice.
Yeah, he's not.
A new room.
Derek.
Wow. Yes.
Derek.
Yes.
You know I like you, right?
Yes, I've been docile for once. I've only fought one
I
person, and
know.
that was
Don't
outside in the street.
don't call my doctors pussies.
But they were being pussies.
Don't call them that.
Yes, I'm sorry, mustache man. I'm sorry, lady. And I'm sorry, George.
It's like, I forgive you.
Yes,
Thank
but
you,
you're
Derek.
my favorite granddaughter.
That's your granddaughter?
Yes, it's George. God, you act like you've never met her before.
Mm-hmm.
My George. Georgie.
Mm-hmm.
Yes, what?
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 What are you gonna get up to?
Oh, I've promised Georgie that I was going to catch a terrorism charge by the end of the week.
She asked you to do
Yes.
that, or you just independently promised it?
No. She's out of town for the week, so she told me not to get up to any trouble. So I said, "Fuck you! I'm going to get a fucking terrorism charge by the time you get back."
Okay.
Yes. Now I just need to. In the name of in the in the in in the name of a point that I'm trying to get across, I'm committing this act of violence.
Derek. Not here.
Bam! Call the police and say I did terrorism.
I'm not calling the police and saying
'Cause
you
I
did
just
terrorism. Just don't hurt
But
my
I just-
worker.
Didn't see anything.
He's fine.
No, Derek, don't troll me. Don't troll me, Derek. I swear to God.
It does that from time to time. I don't know what bloody does it, but it happens every now and then.
I put ice packs in your pants, Derek. Be nice.
I thank you for that.
That's the last place I ever want to be.
I'm packing all right. You're just jealous.
I mean, from what I saw, I don't need to be that jealous.
Oh,
Right, motherfucker.
Oh, okay.
That's deserved.
Die.
That one's
Die.
deserved.
Yeah, you deserve that one.
Die.
Yeah.
Die.
No.
Die.
No.
No, don't turn the hospital into Ramathon.
Where am I?
Hospital.
Oh, shut up. You always got a smart answer for everything I said.
I know. I love Derek.
It was just a little deserved.
Mm-hmm. It was a good one. I'm not gonna say it wasn't a good one, but also deserved a running over.
Oh yeah, definitely. Yeah, you don't insult someone's manhood.
Exactly.
Yeah, my man would. Stay away from it unless you're a guy. I only get himbos on this dick.
Mm-hmm.
Yeah.
And that is your right.
No, where was I? Yes, terrorism. Where's a good spot for me to commit terrorism?
I don't want to say because I don't want to be, indicted in your terrorist act.
Tell me. Tell me or I will commit terrorism right here, right now.
The fuck you will, Derek. You're not committing terrorism right here.
I will commit terrorism right here, right now, if you don't tell me where's a good spot for me to.
You are not gonna do it here.
You will tell me where's a good
You
spot for me to do
already know.
terrorism.
FIB buildings, police stations. Come
No,
on, you're not stupid.
City Hall.
No, the last time I went to the Federal Bureau building, they shot me while I was in a wheelchair, so it's too difficult.
Echo 2776.
Yes, they shot a naked old man in a wheelchair 7 times.
Mm-hmm.
Talk to my lawyer, Jonathan Franklin. Where am I?
No.
What? Guess what? I'm calling the deputy mayor.
Okay.
Wrong number. That was the deputy mayor I just called. It wasn't even the wrong number.
Good one.
Bam! I just committed terrorism over the phone. I'm just that good. Yes, no. What's next on the docket?
Terrorism.
Ah, yes, terrorism. Yes, politics. Political motivation.
Derek, not here.
You never told me where else I could do it.
Yes, I did. I told you several
Oh, yeah,
buildings
you
of
did,
where else
yeah.
you could go and do it.
FIB building, City Hall.
Right, come on, lads, we're off to the FIP building.
What?
Come on.
What?
Come on, we're going to
I'm
the
being
FIP.
kidnapped.
Let's go. Come on, let's go, lads. Come on.
Bye.
Yeah, no, I'm not going down those stairs with him. He can lay down there for all I care.
Yeah.
He tries to kidnap me.
Yeah, he did.
Did
Derek,
Derek
I can
break
go to the
Fitzgerald?
restroom. Derek, try to.
Okay, so since Drew and those had to go, what was the whole why with the oxygen
27,
mask?
23, 13, Bravo.
I
Or
don't really know. I
Marcus,
wasn't here for that.
Okay, so basically, because I never get called to major calls, I was just like saying random events and then or asking about random stuff to
I'm on
kind
the
of
brink of committing
learn more.
terrorism.
Because 99.9 of the stuff that I do is someone got beaten up or bruised, and then I just give them ice packs or the
Thank
basic
you
stuff.
very much. I'll be
Yeah, yeah.
expecting them soon.
So I basically
Thank
said
you.
I get sort of that I can read through the
Dispatch to
SOPs
Eclipse
and
Medical.
see. Send it.
Please stay away from Mr. I guess there's
Don't go
someone
too
at your
fast. I don't
hospital
want
right
you
now. He wants
vomiting
to
all over the floor.
commit terrorism.
Stop. I can't
Yeah,
stop.
that would be Derek Phillips.
Yeah, correct. I'm gonna
Yeah,
send
he's
some
right
units
behind me.
over there. He just called 911 about telling me he wants to
I
commit
like it.
terrorism.
Yeah, he's been talking about that for a while here in the lobby.
Okay, I'll send some officers on your way.
Sleepy
10-4,
little,
thank you.
sleepy. It's a little sleepy person. You guys need to
Uh,
be quiet. They're sleeping.
I'm not
Yeah,
sleeping.
yeah, yeah.
You need to be bloody quiet, or you're going to bloody wake them up, you bastards.
I'm not sleeping.
Oi, quiet. They're sleeping. Thank you.
You're welcome.
Shut up. Be quiet. Thank you. Where am I?
So, what were you saying about the oxygen mask?
So I can read through the SOPs and I can see when to use it and I can learn when to use it. I would rather have like a full understanding of
77s are on
why
the
to
way.
use it. 10-4.
I believe it's when to use, why to use it when you want to get enough oxygen to the body in order to help, keep the patient alive.
So basically, when a patient starts losing blood or has an injury to their chest, their blood doesn't get fully oxygenated. So you want to increase the oxygen levels into the lungs to increase the amount that the red blood cells can absorb.
Get the mayor out of office.
Right.
Get the mayor out
That
of office. Get the
makes
mayor
sense.
out of office.
Derek,
Get the mayor out
I'm
of
gonna
office.
taste you off the fucking
Get the
wheelchair.
mayor out of office.
I'm giving
Get
you
the
5
mayor
seconds.
out of
If you
office.
do, I'm
Get the
tasting you out of the
mayor out of
wheelchair.
office.
I'm tasting him. I don't.
I guess I'm stuck in here now.
No, you're not. You have keys.
Derek, if you don't stop, I'm
Yeah, I
tasing
know, I
you.
know.
Get the mayor out of office.
Put your seat
Get
for
the
a
mayor
minute,
out of
Leslie.
office. Get the mayor out of 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 office.
You okay, Tara?
Derek?
Yeah, I'm good, thanks.
This is typical Derek behavior.
Get the mayor out of office.
This is why he shouldn't have his wheelchair.
You should give him remote control one that we can just turn off at any time. When he's doing stuff like this, we put the brakes on and he can't move.
And thank you. That's what I wanted to know. Because I feel like I can understand, like, I can read myself to stuff, but sometimes there's like an understanding that I want.
Well,
'Cause
yeah.
If I don't understand why I'm using it, I only know that it's the SOP's telling me to use it. That it's not like it makes no sense to me.
Yeah, so basically, if a patient loses X amount of blood or, like I said, has an injury to the lungs, it reduces the amount of oxygen that the blood will absorb. So basically, we just increase the oxygen levels to offset that. Now, this might be like too much information, but a key thing to remember is that oxygen max only
27,
produce about
24, back
50%
to 8.
oxygen. It's also about 50% nitrogen. So it's not just pumping pure oxygen into the lungs.
Yeah, yeah. But it's just a temporary thing because I'm EMS, so I just need to literally keep them stable to get them to the
Yeah,
hospital.
exactly.
So if let's say they were shot in the chest, it hit the lung, it penetrated
Yeah, you
one
would
of the
give them an
lungs.
oxygen mask, yes.
Yeah, you wanna obviously plug the holes and then apply an oxygen mask because obviously that lung is not going to be working properly.
Exactly.
And make sure that they're oxygen. Okay, see now instead of having to read 5 like potential injuries that someone can have, and they're all mentioning the O2 mask. Now I know for all of them already why I would use it. This is why this is why I'm trying to like go through these things because I'm just kind of like I can I get what it does, but I don't understand the why.
Also, I'd give an oxygen mask if they had like carbon monoxide
Yes.
poisoning.
Smoke inhalation.
That's like if someone tried like bad example maybe, but if someone tried to off themselves with like like the exhaust
car
pipe of a
exhaust.
car.
Yeah,
Right?
exactly.
That would be a great
Yeah,
example,
yeah.
yes. Or if they had if they were cooking inside a tent, that can cause carbon monoxide.
Yeah. So at what point do you apply one of these masks? Like you can use one of these for CPR, can't you?
It depends on which method of CPR you use, and if you go with the American Heart Associations, yes, you can apply an oxygen mask and just do compressions. But if you're using I don't know if anyone else still does the breast for CPR, but if you're doing that, it's not going to give enough pressure to the lungs to get the air into it. So you're still going to have to use an actual like breathing device to push the air into the lungs. Like just an O2 mask is not going to push the oxygen
Yeah,
into the lungs.
but as an EMS, I'm probably never gonna have to use one of those. Hopefully, like the
Hopefully not,
oxygen
but,
mask is gonna be my go-to, right? But yeah, I'm thinking, and what about like drowning? Let's say you cleared like the mouth and the nose and the throat and everything from water and stuff like that. Do you ever, and you're conducting CPR? Do you
It
ever?
depends, because that'll be the same situation. Because if they're not breathing, I wouldn't say a point putting an oxygen mask on because the oxygen's not going to go in.
Yeah,
You need
yeah.
something more forceful. I said
Hi.
something to force the oxygen, and oxygen mask won't force it in.
Right. Because the lung is gonna be filled with water, right? So it's not gonna do anything.
Yeah. And plus, if they're not breathing, they can't naturally circulate the oxygen into the lungs.
Yeah.
Now, the reason why like American Heart Association stopped doing the breathing for CPR is they say that when doing CPR, you put enough compression on the lungs to move air a little bit. So, like I said, it just depends on which type of CPR you are trained with.
I'm used to the staying alive.
Yeah. The 30 chest compressions and then the 2 mouth breaths.
Yeah.
See, like her method of CPR, you want to use an oxygen
I
mask.
thought you were supposed to give me an interview.
Okay. So 2 pushes of oxygen mask and then 30 compressions.
Well, 2 breaths per 30 compressions.
Lab and diagnostics.
Yeah. 2 breaths.
Yeah.
You do 30 compressions,
Like
and
what?
you do
Do I
your
need to do
2
like my
breaths,
interview
and then
now?
you keep doing that until you either get tired, or you can safely transport them.
Yeah.
It's a good thought.
Hang on. I think I'm gonna get cold here. I'm gonna head out.
Okay.
Mickey, can you go do with Derek again?
Did he say Milton?
Yeah, Harwick and Milton.
Echo 666 is 76 to the latest 52.
Good lad.
He's so crazy.
She has a broken leg, she thinks. Have you been treated?
No, there's no doctors in the bags. I went up here to look for doctors. Anyone want to treat me? I
She
feel
can't
broken.
drive.
She's very broken.
So once Marcy's done doing the refill, then we can probably
Yeah,
treat
Mercy's. I've already stolen her. I'm lucky.
Also, I just rode an elevator. That was awesome.
Did it
Yeah.
lift your spirits?
Her first time using an elevator, guys. Congratulate her.
Congrats, Becca.
Thank you.
Wow.
I
Look
have,
at you.
I have,
You
I,
look like
I have seen, I have seen
sibling.
them before in a lot of movies.
What?
What?
You like that?
6 is gonna
Hello, this
technically
is Sergeant Matthew
for the
Bush with the
latest
Polina Bay
52.
Sheriff's Department. How can I help you?
The hat looks better.
Imagine denying medical.
I don't think it.
I don't know.
You don't like the hat?
Yes, I
No.
took off
You
the
can wear a
hat.
cowboy hat.
I don't want to wear a cowboy hat.
You sound like a cowboy.
Wait, don't want to be
I'm a girl.
cowboy, baby.
Sorry, a cowgirl. My bad. Thank you.
You're welcome.
Should you be sitting on the floor? Isn't this place like incredibly dirty?
Well,
Strap on?
set.
Oh, strap it on.
That's what I was referring to. Deputy Becca also needs help. She can't drive. She
I
fell
need-
out of a car and can't drive.
I did.
Okay.
Strap it on or get strapped on.
Do I need to go to the back and lay up in the bed?
Yeah. It's just likely gonna be bandage tightening. Do you want to help Bambi or
Yeah.
Tara? Okay.
Yeah.
Hello?
I hate you.
Hello?
Love you.
Yes. Yeah, I can hear you now, Sprint Man. Okay, T-Mobile.
Oh my god, this bed is so comfy. This is the first hospital bed that looks so comfy for me.
Right? Alright, so
I know.
what's going on?
My leggy is hurting.
Your leg
A
is
local
hurting?
tried to kill me, and I flew out of their vehicle.
Starts gazing right into the camera.
Well, that
every scene,
seems
you're like,
really
"What the
mean.
fuck?" Yeah. What's going on?
Say that again.
Alright, so I'm seeing a nasty gash.
Yeah,
That's
like
not
on the
good.
leg.
I couldn't drive.
Well, that's what I figured. I just wanted to give you a heads up because I knew otherwise you might
Yeah,
not
I'm not
see
surprised
it.
with that cut in your leg. It definitely
Seems
wouldn't be able
like
to
they're
drive.
gathering people. So yeah,
Alright,
that's a
That's
break.
not
I'm just
good.
looking at this gun. I'm gonna clean off some distilled water, okay? I'm just gonna see how deep it is, okay?
A lot of brain
Okay.
surgeries. I have a Swedish motorcycle gang that's after me and threatening to stab me, and then I also have like a lot of things going on as far as therapy. I've got another full bill, so I'm doing really well at the hospital. Yeah.
Oh, sorry.
I know, right? So random.
Alright, so this doesn't look too bad. I don't think it's gonna need stitching, so I'm just gonna start bandaging this up, okay?
Hunting, and because I
Now, I'm
would
basically
Okie
just gonna
dokie.
use some compression bandages that's
I
gonna
must
just
also
go
have
around your
fun.
leg,
Quote,
okay?
unquote, stabby fun.
Okie dokie.
Yeah, basically. They're my little mare. Me too. I was like, what the fuck?
Alright, I'm just gonna put some cream on this
Sound
to
like-
make sure it doesn't get infected.
Thank you.
Just 1 second. 1 second, and I will tell you. Y'all doing good, Bambi and Tara?
Yeah, it's just a surface
doing
level
good,
cut.
just
Just need some bandages.
Perfect. Alright, so basically there's an individual that I am giving therapy.
Alright, is there anything else that we can do for you today, officer?
I'm a deputy. But no.
Oh,
I think
okay.
I'm good. I'm probably gonna be back here soon.
Well, let's see how long we can go before you come back.
But stay is try not to overstrain your leg. Don't let wounds opening up again. Yeah, just
Okay,
try
I
to
will
take
do
it
my
easy.
best. I will do my best, but my old partner Bill used to say I'm accident prone, so I don't know what's gonna happen.
Yes, so if you have any problems with the cut, if it opens up again, or if it looks like it's got infected or anything, just come straight back, and we'll be able to help you with it.
Okay, I will do. Thank you so much, all of you.
Yep, you take care.
I will try. Hi. I couldn't drive.
Hello. Oh, yep. That'll do it.
Yeah.
Yes.
God rest her soul.
Yep.
She
Mhm.
dead?
Yeah. See, this is what I tell people. I'm like, I don't even have to I don't have to start trauma because just the most random ass trauma just finds its way to me.
You must have been dispatched to Channel 6.
Send it.
Yes, the fire department is available.
Hello.
Looks like we had an explosion.
Hi. I'm bleeding and I don't know why.
Fly wells.
Oh my god.
Yeah.
Hello.
Hey, from
I didn't care at first, but then it was just getting really annoying and bad. Thank you.
No problem.
Make sure
Marcus,
you
you want
don't
to
have any
respond to
like
that
scratches.
closer from Polito?
Yeah.
Well, yeah, there was definitely a cut in my arm here, but I don't really remember why I got it.
Yeah, let's go get that
Yeah,
cleaned
let's
up.
go get
Never
that
mind,
cleaned
I'll
up.
take it. There's a 47 that just
Okay.
popped in Polito.
Pick your bed.
You're closer to that one.
The first one with the oranges.
This has been the most popular bed all day.
Well, it's convenient. It's right here.
27 is 76 at Polito Bay. Wow.
He has like
Alright,
plastic
then
fruits there.
376 flywheels.
Yeah.
Wow.
Alright, I'm just going to get this cleaned up.
Oh boy. Is the owner of the laundering company telling people not to launder?
That might be coming from the DOJ there.
It actually looks like that, yeah. No person shall disguise or convert the proceedings of crime, stolen goods, or fraudulently obtained property on probable cause. Okay. 100 months.
Echo 27, 23.
Thank you, Bambi.
Foxtrot, sorry.
Do you like Hello Kitty?
Yeah, that works.
Alright, perfect.
So
Hello
just say
Kitty
fire
bandages
23.
it is.
Or
Hell
577,
yeah.
'cause that's, you know, get a fire department.
Alright, is there
Oh,
anything
yeah,
else we
that
can do for
reminds
you today, Kiki?
Not at the moment. I'm good.
Alright, perfect.
Thank you.
And it was something
Alright.
different than a bullet wound. I'm happy.
Oh, I don't get shot for
Yeah.
honestly, I can't think of the last time I got shot.
Locals
No, actually,
are
I
crazy
can.
today.
It's been about 10 years since I got shot. We're good.
Oh, that's a long time.
Yeah, like in the span of 30 minutes or so, we had like 5 people or something coming
Yeah.
in with GSWs from locals.
Oh, Jesus Christ. Why?
Yeah. Nah, who knows?
Oh. How you doing, Crash?
Doing good.
Well, that's good.
People have been encouraging me to apply for EMS.
Really? Okay.
Mm-hmm.
You thinking of doing it?
Fire 23.
Yeah.
23
Nice. All right.
flywheels.
Has the hospital stopped being the most dangerous place for you to
Echo
be?
27, 24.
No, it still is.
Back 10 6.
Okay.
Clark just wasn't around yesterday, so.
Okay. I see.
Fish jail is pretty safe.
I don't know. Is it? Wait, where is it? I thought it was
It's in
supposed
the
to be.
lobby.
No, he
Here.
passed through it.
Oh. Okay.
It's very broken.
Why is it broken?
Well, I think, at least for me, it is.
Oh, it's a
because
TV.
Derek wasn't, it was in there earlier, and
Oh, I was gonna say it looks.
Oh, yeah.
alright.
Yeah, we had one Derek in here.
Yeah, it looks okay.
but, apparently Fish just likes tossing himself in between the elevator doors.
Yeah, apparently Q said keeps him quiet. He's fine.
Look, as long as he's
Oh.
entertained.
I'd rather he be crushing himself with elevator doors than attacking other people's animals and people.
Yeah. But yeah, I'm thinking about becoming EMS. I'm gonna talk to Clark when I see him before I make a decision, but
Okay.
I do kind of miss it.
I miss it sometimes, but then I'm like, no, I've been there, done that. I'm good.
People are impressed by my medical knowledge.
Mm-hmm.
That's why I think they're pushing me to try it again, is because I know a lot about medical things.
Well, if it's something that you want to do, then go for it.
I do. One of the EMS was like, you can replace Chris. Chris is one of the trainees.
I'm gonna say I don't know who Chris
Oh,
is, but
pardon
that
me?
makes sense.
He's one of the trainees that keeps accidentally punching people, so they make him run laps.
Oh my god.
Yeah.
Oh my god, indeed.
He's also the one that posts a lot. Like, he's a very opinionated individual.
Oh, which Chris is he? Because Chris is a very common
Chris
name.
Smith? Yeah, Chris Smith. He tends to post a lot of very opinionated comments on Twin
What's something
stuff.
that he said recently so I can actually find him?
There's so many posts on Twin stuff. Hold on. I think he's calmed down a little after his memory got a little bit jumbled, but
He wrote, I love to see that Fish is the only one clocked on as DMV employee.
he also made a comment a while back
There he is.
about the VU, which caused him to get in trouble with Umber, who's his superior.
What the? I hope to have a 5K by then?
No. He likes the VU now, but before he liked the VU, let me find it. He used to, like I said, I think ever since his memory got jumbled, he's not as out and about with his opinions. But he was upset about. I ain't fucking with VU. Making that clear. I just don't get why y'all are horny on Twinstem. I'm over that phase. Due to me being in prison for 2 years and the last 2 years of me just healing my soul and traveling the mainland. Well, Umber, the owner of the VU, they saw that comment and immediately called him out for it. Umber's also, I think, a captain for the fire department. And I think ever since she called him out on it, they called him out on it, he changed his perspective on it. And I guess he ended up asking one of the doctors who works at the VU for a lap dance. That was a real quick turnaround.
147 doctors from EMS.
Send it.
Area 147 blown up by gas tanks. Had cardiac arrest on scene, got the heart back restarted, still unconscious. Burns all over.
Huh. Sounds like a burn victim.
Yep.
A little bit of heart issues.
Hey, firm.
Why are you sorry?
ETA about 2 to 3 mics.
Foxtrot 27, 76 to another Paleo Bay down. I believe it's the same person.
Hi.
Hello.
Oh, yeah.
Alrighty. Most likely drove their motorcycle into a gas pump. Burns all over. washed out and wrapped with clear film. We lost pulse when I arrived on scene. Got it back with CPR. Pulse has been stable. Breathing has been stable. Got them on an O2 mask. Also started them with an IV because, well, burns dehydrate. So we got them on some fluids as well. They have not been conscious.
Foxtrot 27, 24, 10.
And that's basically it.
The burns, are they
They're minor to moderate.
Okay.
Yeah.
Alrighty, let's see here. So, what's your first thing to do with the burns there?
Sorry. First thing is basically make sure that they're clean. First thing I was wondering about was severity, if there was any like level 3 burns or if it was just type 2.
Okay, I'll just get some damp clothies here, because usually what my go-to is to start cooling the burn so it doesn't basically get worse.
Yes. Stop the burns from progressing.
Mm-hmm. Alright, it seems like the vitals seem to be in a bit of a destabilized state there, so
76 to Eclipse.
I'll get the fast rapid infusion going of the ringers to support the heart there. Just get this cooled down a bit here. Quite extensive burns there. Right. All right, what are we doing here? Let's see. Make sure the airway's all good. Getting plenty of oxygen there.
Should I be pushing epinephrine or vitals or dropping?
Yeah, might have to get some support going there. Do like a milligram drip over a couple minutes there to get this stabilized. And like I mentioned earlier, some inotropes like dobutamine. That'll help the heart keep pumping.
I'm freezing.
I think I'll have some with me there. I'll get that added to the line also.
Here's your saline. No, you didn't. Alright, vitals are stable. Yeah, like I would have no clue how to spell that, to be honest with you.
523, 76 lives, 47.
Alright. Alright. Try to make sure all the burns are neatly managed there. We'd have to get a small little moisturized cling film wrapped around also. And that
523,
cheek
23,
area
27.
there might need some bit of a tender care. Don't want to have the burn leave any nasty scar. And okay. All right, what else should we look out for in this kind of case there? Get these wounds all neatly treated there.
Basically we want to look out for abnormal bleeding or pus coming out of the wounds.
Mm-hmm. So we'll probably make sure we have some anti-inflammatories and antibiotics running also.
Okay.
Checking all good here. Alrighty, let's see. I'll see if I can keep her here, or maybe a friend. Also, okay. You'll monitor the recovery and see if they'll regain consciousness here, or we'd have to get them to the recovery room back there.
Hi, Gasper.
Oh. We have
Oh.
consciousness.
Hello.
We gotta stop meeting like this.
Oh, that's unfortunate, I suppose.
make it.
Oh, let me let you closer a bit. Here you go.
Hi, Imogen.
Hello.
2324.
How you feeling?
Why does it smell like petrol?
Because you exploded the gas pumps at Flywheels.
Again?
And also maybe petroleum jelly.
Again.
Wait, why would we use petroleum jelly?
No wonder why we got such a bad slush report.
Don't tell Gandhi that.
How you feeling, sir?
Like I got toasted and I'm a marshmallow waiting to be ate.
Well, that's pretty
We'll
accurate.
keep you wrapped up. We'll keep you in a moisturized mummy state.
I'm just gonna get you a little bit more comfortable, okay?
Okay.
It is a girl. It's a girl, no boobs.
Alrighty, yeah. Might need some little burn care there, just a tiny bit. And a lot of
Okay.
hydration. Keep those burns neatly moisturized, because yeah, the burns usually dry up the skin like the Sahara Desert.
So I should drink more tequila?
No.
not tequila.
Alcohol
Water.
also dehydrates the body. Water.
Yeah,
Lots of
water.
water.
Sweet tea. You can get a bunch of sweet tea from the yellow chick.
Oh.
Yeah.
Sweet tea's better than alcohol.
Okay.
She good to go home?
Well, if he wants, we can take him to the burn unit and stay there for a bit.
Can I have a wheelchair like you?
That costs money there.
What?
Mm-hmm.
What happened to the free healthcare system?
Well, the free healthcare is for the treatments and medication administered during treatment.
So why am
But
I paying business tax?
Well, the wheelchair is basically it's like an extra, Still, it costs us quite a bit also to get it from our manufacturer's factory there. So, yeah, otherwise we'd be going broke if we handed them out all willy-nilly.
Is there a discount?
Well, yeah, there's a poor discount.
I'm poor.
$500.
Deal.
Okay. Alrighty, what's your state ID there?
9634.
96. Wait. Oopsie. Charge. Hold up. We gotta make sure they pay for the poor wheelchair first.
Come on, Doc. You wouldn't leave a poor young man stranded in a bed like this, would you?
Well, I need to have my hospital up and running, and getting our medications and all that stuff.
All right, just leave the key to the pharmacy on the side, and we won't have no trouble. All right, Doc?
It's fine. You can get some simpler over-the-counter medications at the pharmacy there also.
Okay.
Might be some burnt cream also. I don't think. Didn't think we had. Good to have, actually. Burnt cream. Add that to the list.
Hey, Doc. I need to scoot out of here.
Okie dokie.
I need the goods. I need the juice.
Alright. Bambi, did you get him?
No, I didn't give it to him. Did he pay?
Yeah.
Okay.
I got the juice.
And Marcus, is that meeting still going on?
Good to skedaddle then.
No,
Thanks,
I just
doctors.
took a while getting back down.
No problem.
Yeah, fair enough. I just saw a huge cop
Is
stack
there
there.
a
and I was
bar
just like,
nearby?
"Oh, is this
Yeah,
still going
they're all having a chin wag.
Bar?
The meeting
What the
only
hell?
lasted like 20 minutes, but I
Tequila.
missed it because the same person kept
No,
crashing
I
their
don't.
fucking
You don't
bike.
want that. Don't do that. No. I hope your friend here takes good care of you, right? Yeah. Yep.
Okay.
Yeah, I'd also recommend staying away from South Side locals. They do be wilding today, shooting everyone.
Why are you crawling? Didn't he give you a wheelchair?
Yeah, but that's for the special occasions.
Oh
What the hell? Oh, okay. Alrighty. I would say like maybe one like a small nice little detailed chat there, and I think we should be good to slowly get you moved forward.
Okay.
Because you're doing okay there.
I'm
Pretty
really
good.
surprised to hear you say that after I just brain farted on that last patient.
That's fine.
My brain like froze on degree, and everything kind of went downhill for me after that.
Well, we can always go over the different stages of burns and how
Hello,
to treat them and so forth.
Hello. You were too late with responding. I'm sorry.
You're good.
If someone else needs food, they can. Fancy? You want it back?
No, someone gave me like 3 watches, so I'm giving you one.
Thank you. Well, if someone else is hungry, you can give it to them as well.
Okay.
Yeah, you were that too late to respond.
Don't go too far. I'm going to need a ride.
Oh, you're clocking out?
Yeah, Casper's my only doctor on duty right now, and he's about to go off duty, so.
Well, I'm still on duty, but I can wait a bit.
Okay.
Oh, wow. Yeah, I hate myself, so I decided not to. Why not? Yeah.
Yeah, I was about to go off duty there.
Of course you would.
Yeah.
You hate me.
It's fucking annoying.
I still
Okay.
don't remember my call sign. 4741.
How?
Adeline.
That's my name. Oh, hi, Crash.
Hi. People have been encouraging me to apply for EMS. Do you think I should do it?
Do it. Do it. Yes, you really should. I promise you. It's a nice thing to have.
I'm doing another final.
I love it. I do. I've been doing it for what 11 months now. I'm just burnt right now, but
I'll move the star
but
as we go over.
I think you should give it a try. You love taking care of pets, and if you can just put that pet to people,
Echo 58,
I think
You
you'll
gonna
do
go to Gay
amazing.
Bay?
I have a previous experience.
Oh yeah.
Oh, then hell
well, I
yeah,
would need
yeah,
a
then
ride
hell yeah,
to
you should definitely apply.
Darby.
Back where I used to live.
Congrats, by the way, Marcus.
I'll grab my car and then.
Thank
I
you.
remember my call sign.
You could just drop me off at
I
MRPD.
don't know if we have we do have
Take my car. It's fine.
Oh my
I don't
god,
need to
buying
be at
armor.
40 again.
So much money from the budget.
No.
Very distinctly remember my old call.
I was.
Just let me know when
I
you're
was
ready to go.
off for like a day, and then we changed our call sign. Oh.
Well, hello.
Hello.
Gay Bay?
I don't have that much longer, so I was thinking of just hanging out.
Sure. Where do you want to go?
Let's go to that spot that I showed you.
Ah,
Or we
okay.
can go to Chumash Pier.
Chumash Pier, okay. Got it.
So the positive thing is I was trusted to treat patients by myself today.
Hell yeah.
So I gotta treat like 4 patients unsupervised.
That's amazing.
The downside is we had a burn victim come in and I completely brain farted and froze up.
Oh no.
And it was bad because all that brain fart in my head is I couldn't remember the word degree. So I was like, okay, you have a first classification burn, and then everything just went downhill. Because I couldn't get myself out of that rut.
Oh no, honey. Well, that can happen. I'm thinking you're still fine.
Yeah, Casper didn't even realize that I brain farted. I had to tell him afterwards.
Well, I'm gonna have to change my way of dispatching a bit.
Oh, how so?
Well, today at the PD meeting, we were told it's gonna be PD from EMS from PD or EMS from dispatch instead of dispatch to EMS.
Okay, so you have to start with who you're contacting.
Yeah. You know how long I've been using it? What I do right now.
The way, yeah.
It's kind of like nature of where I'm coming from. You first announce yourself and then who you're like directing to. Not first who you're directing and then from yourself. So how much time do you have left?
I got about an hour and a half.
Oh, just like regular.
Yeah.
Okay. Well, I was just asking who the owner was because I wanted to check if actually someone was around because I saw Winston in there, but I didn't know he was the owner, yes or no.
No, he's just a mechanic like me. And Winston doesn't usually actually do repairs. Like, he'll sign in so it looks like it's open, and then he goes off and does other things.
Okay. Well, I still feel like you should be able to do paints and tints. You've been there long enough.
Yeah. Like, don't get me wrong, I love Ivy and everything like that, but it frustrates me that she got senior before me.
Well, she does have. Okay, she does have a different time zone than you.
I know. That's the thing, like, NA has senior mechanics. My shift does not. Well, sometimes we do, but
Yeah. Yeah, don't look at my car. Some local ran into it while I was parked at
that's
Toledo.
okay.
You know, I'm gonna be a little bold here.
What's up?
I like those shorts.
Oh, thank you. What do you like about them?
I mean, I wouldn't say black is a color, but black is my favorite color.
Okay.
And that, I'm not saying you should turn yourself into a goth girl, but I do like black.
See, and I put these on because I thought you'd like them because I thought you'd like the tights.
Well, that's the second part I like about them, but I didn't want to make it too obvious.
Well, I've been dressing this way to try to get your attention.
Well, you always got my attention. You know that.
Hello.
Hello. Nice day of fishing. No, thank you. I'm pretty poor. Well, oh, that's a good catch, man. Well, enjoy fishing. I said enjoy fishing.
Alright, appreciate it. Have a good day.
Have a good day. Oh my god, I just said that in front of those guys. I thought they were locals.
I did too.
So, all with all, your day has been a pretty good success.
Yeah.
Besides just one brain fart, but that's okay. I mean, everyone has those. Especially on the most crucial times, you know? You know what you should do? Bambi?
What's up? Sorry.
You should just gift me a text.
You want me to give you a text?
Give Timmy a text. You know, the owner of Gay Bay.
I'm confused.
Oh, about like getting your promotion and such. Like I think he's been looking for you, but doesn't have your time zone.
Well, he knows my time zone.
I know he does, but didn't you say like he was looking for you at Mondays and Tuesdays and you weren't there?
Well, yeah, but like that was just rumors. Like I don't know that for sure. You know.
Yeah. Okay. True.
Sorry, there
Sometimes.
was a rule that came out in Dr. Chat, and I was letting Polito know.
What was going out in Dr. Chen?
So for a while there was this rule where you had to have so many doctors in like Eclipse in
Yeah.
order for someone to work in Sandy or Polito, and this was a big issue for manning the Polito hospital. But now that rule just got removed, so doctors are now free to work wherever they want to work.
Wow, so you can become a doctor in Polito.
Yeah.
Is that something you wanna do?
I don't know. So the problem is like when I'm planning on working doctor, um, there's no doctors in Eclipse, and that's where EMS stations. The nice thing about this is, let's say I'm working at Gay and someone goes down in Polito, I can just clock in Polito now and treat them.
Yeah. I don't know if that's allowed.
Well, it's allowed now. Well, once I become full doctor, at least.
Yeah, okay. I mean, I think you should just find out what like is allowed. If like, I'm not sure if you're just allowed to do one quick fixer up and then sign out again.
Yeah, that's fine at the hospital. It's just not fine at Gay Bay.
Ah, okay. Well, that's good to know. You already know that. That's nice. Just as I'm gonna have to speak to Lennon and or Stephanie about like the potential of mobile dispatching and stating the issues about dispatch pay.
Yeah.
Only I'm a bit afraid of Stephanie right now with all the recent things happening.
Why are you afraid of her?
I think she's gonna scold at me.
Really?
Yeah. You know what I told you yesterday?
Kind of. We talked about a lot yesterday.
About the department day?
Yes.
Well, I think she's gonna scold me for that one.
Well, just take it with a grain of salt. You already said sorry.
Yeah, true. I think, yeah, I just need to speak to one of those about some stuff, but Lennon is normally very early shift 3, which is like 1 or 2 hours after we normally go to sleep.
Yeah.
So I might have to stay awake awake a little bit longer, which should be fine because I'm working from, or my nightmares are from home tomorrow. So So did you have to do much with Mercy today, or was it just Casper?
Just a little bit. I think I did about 5 patients with her. And then I did about 20 patients with Casper.
20 patients. Holy.
We had a lot of gunshot wounds.
Really?
Yeah. Locals are going crazy apparently.
How did things go with Mercy?
I just kept quiet.
Oh, so you put up your smile?
Yep. I did what you said.
Nice. The smile you have right now, the cute one.
Yeah.
I think the fisherman went away.
Yeah, I don't hear them fishing anymore.
Since we're alone.
Oh. You okay?
I am now, yeah.
Okay.
I'm sorry, that was not supposed to happen.
Yeah, I figured it was a muscle spasm.
Yeah. So, would you stop me if I would jump from this?
Yes, I will stop you.
Okay. Because, you know, I sometimes get intrusive thoughts. Which are very intrusive, you know?
Yeah.
Which sometimes result in just doing dumb stuff. Like jumping from this.
Well, I don't think you'd injure yourself if you jump from here, but let's not test it.
No. No. Let's not. Well, there's a ladder on the side, so I can just basically climb up again. But no, let's not do it.
Yeah, let's not. Especially since you're still healing from a brain injury.
Yeah, definitely. So you got anything exciting besides the gunshot wounds, or is that classified?
It was. We had a couple TBIs, but they were coming in from ICU. So,
Oh, okay.
like, basically just verifying the TBI is no longer a severe issue.
Did you also... I'm assuming since you said you're about to be signed off, you got your broken limb.
I did not get broken limb.
Oh.
But even Casper was like, I think we're going to try to finish you off here soon and get you signed off fully.
Oh, yeah.
So that's the third doctor who said that they were going to try to get me full-time doctor shortly. So fingers crossed.
I mean, Casper seems to be more around.
Yeah, he is. But he doesn't treat patients right now.
Oh, I figured with the wheelchair and stuff.
Yeah.
I
So
mean,
basically, I was treating patients for him today.
does this mean you're gonna have to study up for like the next couple of days?
I have been. I need to study up on medications big time with Casper.
Okay.
That's one of my struggles is in the military. I never prescribed medications outside like Tylenol and ibuprofen. So
Yeah.
I'm kind of weak on medications and what to use when.
Well, I think if anyone should know, it should be... It should be Casper.
Yeah.
So who can actually sign you off as a full doctor?
Any chief.
Any chief. Okay, so Casper is actually able to.
Yes.
Okay, good to know. You know, I like to snuggle up a little bit sometimes.
Have I gotten you addicted to snuggling?
Yeah, a little bit. It's just so comfy. So my day was like, it started with chaos, and then it went quiet for like an hour, and then it went chaos again, and then went quiet for an hour, and then went chaos again, and you know, it's like to do it in waves. I'll just decide, okay, let's just do crime all at the same time, you know? And then we had a situation at Polito.
Oh.
So I actually don't know how much I'm to tell. I'm
Well,
actually
don't tell
allowed to
me
tell.
anything you're not supposed to.
Maybe it's better if I don't say it anyway then, because I don't want to accidentally say something which I'm not allowed to. Because I really want to, but it's just I don't know if I am allowed to. Well, it doesn't say anything. Okay, so basically at Polito, we were having a meeting, and just before the meeting, we had a lot of cops circling Polito.
So Cyrus got upset.
Yep. Especially Winston and Kiki.
And Kiki?
And Kiki.
Interesting.
Kiki was on the bike with Winston. But she didn't, like, I saw her later at the diner, and she was okay.
Yeah, I treated her today. She had a cut on her arm.
Really?
Yeah.
Just had a little chat with Kiki and was like, yeah, how are you doing, Kiki? And she was like, oh, look at you becoming dispatch and such. And I was like, yeah, I'm gonna have to bring Bambi some food. She was like, oh.
Oh.
Well, you know, the oh Kiki does.
Yeah. I think she knows. I think Jason told her that we were dating.
I'm not sure.
Well, so if not, she knows now. The other day, me, Jason, it was after you left Gay Bay. Kiki came over and made a comment about how there were 3 people at the diner, and there was one redhead, one brunette, and one male. And then there was 3 people at Gay Bay, and there was one male, one redhead, and one blonde. And she was like, "It's so interesting how you divided yourselves." And then Jason was like, "Yeah, well, we had another guy here, but he left." And then Kiki was like, "Oh, who was that?" And Jason was like, "Oh, Bambi's guy, Bambi's male." Can't remember exactly what he said.
Okay. Well, I guess Kiki knows.
Yep. So now she would have put that together.
Well, I don't really care if she knows yes or no.
Yeah, I don't care if she knows either.
So, about hanging around more at Polito. You sure it's okay?
Yeah.
Okay. Yeah, I should have spoken with you before I spoke to with Ivy, but I'm like, you were asleep. I didn't want to bother you. You know. Didn't want to wake you up. We were, well, me and Ivy were having a chat anyway. We were talking about the letter I made for you.
Who were you talking to about that?
Ivy.
Oh, okay.
It was after I made it. I sent like, look, I made a letter for Bambi. And she was like, "Oh, cute." And they were talking about Polito and going there, and that you got me to go to Polito more because you're hanging out there, and which is fine because I normally only go there for you. That sort of stuff. And then we were like, then she was like, "Yeah, maybe you put Polito in the wrong light because you haven't been there for a while." And I was like, "Well, I've been there in the beginning." And she's like, "Yeah, but things change." And I was like,
I
"Yeah,
do
that's
feel
fair."
like Polito, like from the time that I was hanging around in Polito to now, Polito is completely different. It's no longer like as much of a hotspot. Like not as many people hang out there anymore.
No, it's because I think they also advertise it's for the gays.
Well, not
You know,
everyone there is gay. Like Ivy's, I don't think Ivy's bisexual.
I have my doubts.
Cause I know Ivy's dating Eli, and Eli I know is straight. No, straight people, heterosexual people do hang out there. It's just there's a lot more gays than LGBT.
Yeah. But then I just explained to Ivy, it's more like rumors I heard about myself, people talking bad about me behind my back, which kind of turned me off about the place. But now I want to be there with you.
Well, thank you.
I just want you to have a place where you feel like safe, secure, welcome.
Well, right
Place
now,
to hang around.
Polito's like the least safe place for me, in my opinion.
Oh, why?
Because that's where I got taken hostage.
Yeah, I'm still surprised they dare to take you hostage from a place where Osiris is ruling.
Yeah.
Just like I'm always surprised that people still do crime in Grapeseed because Grapeseed is Grapeseed. If you
Yeah.
do something, they know, and you get the whole Grapeseed force behind you. Or after you, which is kind of insane. I won't ever will let you get taken hostage again.
Well, you're not gonna be there protecting me all the time.
I'll make sure. I'll check up on you regularly. I'll make sure you respond. And if not, well, I'm dispatch.
Right. You can actually look at my location.
Yeah. I'm tracking you. You're tracking me. We see each other's location. I mean, if I see you without me going to like the Mount of Top Chilean, I know something is wrong.
Right.
Unless you told me in a text like, I'm gonna hang around with people to Mount Chiliad, just don't be scared. I'm gonna be scared. Oh yeah, I forgot to tell you. Zoella wants to do hiking with a friend of her with us at some day.
Okay.
And also, hold on. Let me check if I was right. No, that was it. She wanted to do hiking. She wants to go hiking for so long. I asked her, yeah, can Bambi come? She's like, sure, if I can invite a friend as well. I'm like, yeah, sure, why not? No, it's not a double date because she doesn't really see that guy as a potential interest.
Okay.
It's just a good friend of hers, she said. Then I told her, yeah, like that's how me and Bambi started as good friends. She
Yeah.
was like, no. You know, just so I love things. I just need to find the right time and date we can be all together and just go hiking. Because she is like up 2 to 3 hours prior to when we wake up. Normally. Penny, for your thoughts?
I'm kind of blank thinking right now, I'll be honest.
Exhausted?
No, not really exhausted, just here in the present. Just kind of staring out into the void of the sea.
Yeah, those waves are massive today.
Could you take off your glasses?
If I could take off my glasses?
Yeah.
I can.
I was thinking about this today that I didn't know what color your eyes were.
It's just like how about we never spoke about our age before.
Yep.
Yesterday. So what color are they?
Your eyes are blue.
Hell yeah.
Did you not know which color your eyes were?
I did. I was just asking. Just to make sure you got the right color. Now, let me put my glasses on because I'm seeing nothing right now. Well, I saw you double, which I'm not really not liking, but two of you would be a lot to handle. Oh my god, Grapeseed is hiring groundskeeper Willie.
Oh, really?
Yep. At least I'm looking for someone with a Scottish accent. And looks like groundskeeper Willie from Simpson. That's very specific for for recruitment.
Yes, it is.
I want to check something. Hold on. There we go. Now I can look in your eyes all day long. Into your freckles,
My sunspots.
your sunspots. So what was that?
Nothing, I was just laughing.
Okay. Your pink eyes. Did you color your eyebrows?
Yeah, I put makeup on. If I didn't wear makeup on my eyebrows, it would look like I don't have eyebrows.
Oh, really?
Yeah. My eyebrows are pretty much translucent without makeup on them.
I was wondering because you have blonde hair and like darker eyebrows, which was your natural color.
Well, I also dye my hair. My hair is usually a little bit darker than this naturally.
Ah, okay. Sorry, this is just so tempting when I'm sitting here with you. I do still like the lighthouse better and the top of Montchiliad. Even though I see a dolphin right now.
Oh, there's dolphin.
It's like almost near to the other stairs, to the ladder. Oh, it's gone now. It's like swimming dolphins really close here. Hey, there it goes again. Like northwest of us. Where they normally pop up.
Oh, okay.
What was your favorite place we've been so far?
Honestly, I really like this spot that I showed you.
Yeah, I do as well.
Like, don't get me
It's
wrong,
just
I enjoyed the lighthouse and I enjoy Mount Chiliad. Just there's history to those locations.
wrong history to those locations.
Yeah. I mean, it's nice to have positive thoughts to those locations, but
Well, if you want, we can find a complete new location only for us.
like even here in Chumash Pier, like I know a lot of people that got murdered here.
Oh, do you want to leave?
No, I chose this spot to come to. We're good here.
Okay. I'm happy to find us a new place though, if that's what you need. Just for the two of us. Only happy thoughts.
Just the two of us. We can make it if we try.
I mean, we're already trying. Aren't we? I think we're doing a pretty good job.
Yeah. It seems to be going well so far.
Yeah. Don't feel like I've done anything stupid yet.
Except for calling me an old bike.
Almost forgot about that one. Damn it. I didn't mean it that way, you know.
I know.
Fun
Doesn't mean I'm
to
not
bully
going to give
me.
you shit for it.
Yeah, I know. I expected that one, to be honest. Even though you have some bad memories about this one, I can still sit here every day, all day with you. That will mean I will make no money anymore.
Right.
And I think we will run out really fast on food supplies.
Like I said, like when we hang out like this, we should sign in at the Guru.
I forgot about that one.
I did too. Not to mention, it's only gonna be like an hour and a half, and I gotta
True.
go to bed. So.
Well, it's 50 minutes now.
Yep, I got about 15 minutes before I have to go to bed. Honestly, I should probably go to bed a little early today, though.
So I want to head there.
No, we still got. Even if I go to bed early, we still got 20 minutes.
Okay. If you could pick anything in the world, what would be your favorite food?
Cheesecake.
Cheesecake?
I love cheesecake.
I will try to remember that one. Don't think there's any in this city, but
There is.
Really?
There's a place in Sandy that sells cheesecake.
Really?
Yep. I've repaired their food truck.
I'm
I've
gonna
only seen
find
them open like 2 or 3 times though.
I'm gonna find that place one day. I'm gonna bring you a lot of cheesecakes.
Just remember, cheesecake goes bad really fast, so don't get too much.
Okay, I will get a proper amount for you, which won't go bad before you have ate them.
When I was in the military, my parents bought me this cheesecake through like this company that mails it, and by the time it got to me, it was all moldy and stuff. It was disgusting.
Oh
Yeah,
no.
the thought is what matters, but yeah, I thought it was funny that it was all moldy by the time it got to me.
Yeah, I'm with some mailing things. I'm like, how does that even work? You mostly have to eat them the same day because else they will go bad. Do you have a question for me?
Not at the well, I do have questions, but I want to try to figure out myself first.
Oh. Wanna try out find it out yourself before you ask me?
Yeah, it's funner this way. Not to mention I have time.
True. I just wanted to try and do something to, you know, enjoy your time a little bit more. Damn, I forgot about something.
What's that?
I could have taken you swimming
Yeah.
to the spot where we found the swimming pool.
You just want to see me in a bikini. Not that you haven't seen me naked, but
Can't deny that. Also, don't really feel offended in this way, but I want to see the VU once.
you want to go to the VU one time?
I want to see what it is.
Okay. I gotta go with you though.
I didn't expect anything less. Because I've seen the people who work there, and I'm like, I haven't an idea what it is, but
My only rule is you can look but not touch.
what if I only wanted you?
Well, no, you're gonna guess me. That's why I have the rule. Don't worry, I'll follow the rule too. I won't touch either, but I get a look too. You've gone quiet.
Yeah. Because it just feels like I'm not really a drinker, but it feels like a place we can hang around a little bit as well, since you know a lot
Yeah.
of people.
I know a lot of the dancers there. Because a lot of the people who work in Polito also dance there.
Well, then you got to say, "Don't touch him. He's mine."
Well, they can touch us. We just can't touch them.
You can still say, "Don't touch him. He's mine."
He's mine.
Don't dance for him. He's mine.
Well, that's part of the fun of the VU is you get private dances.
From you?
I'll give you a private dance anytime, Dave.
Yeah, that's RV stuff.
Maybe I can learn a thing or two from them dancing, give you a better dance.
You did a pretty good job last time. Let's say it like this. Got me all flustered and stuff. That's like your specialty, getting me flustered.
I do have fun getting you flustered.
I
But
know
it's going
that.
to get harder and harder to get you flustered because you're going to get used to it. Which is kind of the point.
Doesn't mean I'm still getting flustered.
You get it? We'll
You know?
it's going to get harder and harder. And that's the point.
Well, I think you're just filling my wallet right now.
Oh, okay. Is that a cell phone in your pocket, or are you just happy to see me?
Actually, both.
Oh, okay.
That was just as corny as when I said yesterday I felt for you.
Yep. It's okay. Sometimes corny is good.
It is. I've heard people talking on PD radio. This is nothing compared to that one.
Yeah, okay.
I even think I heard rumors about some EMS orgies.
I have heard rumors about this.
I'm quite scared.
Well, don't worry. I'm a doctor, not an EMS.
That's true, but I don't know if they include the doctors.
I don't know. They might. I've never heard of them actually going to one, so I think it's more of an NA thing than a EU thing.
Yeah, might be. You know, I actually kind of want to slowly walk you back to the car right now.
Okay. No hands.
Because the one thing I can miss about this place is the smell of fish.
Well, them fish in here probably didn't help that smell.
I'm sorry?
Them fish in here didn't help it with that smell.
No. Then it being a fishing dock doesn't really help either. With all the fishing boats and nets. But man, looking at those houses with the beach. One day.
One day, maybe that can be our final goal.
Yeah, one day. Now something really bad comes to mind.
Oh, what's that?
We can go skinny dipping any day we like.
Yup.
As long as it's not winter and too cold.
Oh, you worry about it being too cold?
Yeah. Doesn't really do magic.
No, it doesn't.
Do you wanna drive?
You can drive. I'll be passenger, princess.
Do you like being passenger princess?
It's kind of nice.
So, do you have any other place in mind, or do you want to go to the RV?
Let's go to the RV. I think I'm gonna go to bed a little early today.
Oh, that's fine. I think I'm gonna stay awake for a little bit longer.
That's fine. You gonna do more dispatch work?
Yeah, I might be. Because I still have to speak to either Stephanie or Lennon. Maybe they'll be around tonight. I don't even know how my car got so banged up like this.
It happens sometimes when you just park the car and locals just come and hit it and hit it and hit it. It's annoying.
Yeah, they should take away driver's license for locals, to be honest. Also, I know you want to have a Dominator, but I think they're about to ship in new cars soon.
You know, I've heard rumors about that.
I'm not saying we'll be able to get your Dominator before that happens, but I would say let's wait a bit.
Okay.
I know you want a Dominator really bad, but you know, maybe there's some good cars and some nice cars you maybe even like more.
Yeah, but the new cars are probably gonna be really expensive.
I guess we'll have to see. Because that's what I'm thinking with like... Oh, okay. With like bikes as well, because everyone's saying the current bikes are not that great. They've been saying maybe some new bikes are coming as well with the new cars. But that's totally up to you. If you say like, I still want to have a Dominator, then I'm just gonna try and achieve that for you.
Okay.
Also, do you mind if we make a quick pit stop towards
that's fine.
Grapeseed?
Yeah, that's fine.
Because Since we have the RV now, I want to actually get my Karen Rebel away from there.
Alright.
If you do have a little extra time. I'm just looking out for the salt flats. I think that's the water. Yep. Hi, babe.
Hello.
Well, that was unexpected. So, before I got so rudely interrupted, you know, babe, I love you.
I love you too.
I guess my headaches just were like, nope, you're not gonna say that today. Let's see if my key is still in my trunk. It actually is.
No.
Hello.
Hi, Astrid.
Hi. Hi.
I was just here to get my car and bring it back to RV.
Yeah, of course. That's alright. It's alright.
Okay,
Yeah.
well, good luck. I'll be back soon because I'm gonna be able to get back on duty.
Bet easy.
See ya. I think there's something wrong with RV. It's missing walls.
Yeah, it tends to do that.
Well, I'm hoping people cannot see us from the outside.
No, they shouldn't be able to.
Oh. We do have a box here, so I'm gonna put my rebel keys in there.
I did not know we had this. Oh, it holds so much stuff too.
Yep. I do still be a bit curious about how our TV works.
I can't get it to do anything.
Maybe we should talk with the higher ups about that one. Because I feel like you should be able to do something with these TVs.
I'll ask someone if
Okay.
they can. I know a couple people who want RVs, so. Oh, I'm sorry, you went for the romantic one.
Yes.
There you go. I'll fix it for you.
Can't say I don't really love these puns.
You like them that much, huh?
Mm-hmm.
So, do you just like them because they're black, or do you like the tights with them?
Both.
Okay.
Just because what they're hiding.
Oh, you just like what they're hiding, huh?
Mm-hmm. I left the side prep at MRPD in my personal locker.
You left the what in your personal locker?
The plastic wrap.
Oh, okay.
My gun is there as well.
We'll use that for special occasions.
Yeah. I don't think that it will be there when I get back tomorrow.
Probably not if it was already 20% went this morning.
Yeah.
I like how Bambi's like on her tippy toes. Alright, I think I need to head to bed. I love
Alright.
you.
Love you too.
See you tomorrow?
See you tomorrow.
Okay.
I'll be a little bit later tomorrow.
That's fine.
I'll be sleeping in a bit.
That works perfectly fine.
Okay.
Love you.
Love you too. Have a good night, sweetie.
You too, babe.